From the JAMA Network, this is JAMA Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinion featured in JAMA.
Welcome, and thank you for joining us for this JAMA Author Interview podcast. I'm Dr. Tracy Lieu, Senior Editor at JAMA, a pediatrician, and Director of the Division of Research, Kaiser Permanente, Northern California. Today we'll be discussing an important new study in JAMA titled Racial and Ethnic Disparities in All-Cause and Cause-Specific Mortality Among U.S. Youth. I'm delighted to welcome this commentary's author, Dr. Steve Woolf. He's the Director Emeritus and Senior Advisor to the Virginia Commonwealth University Center on Society and Health and the C. Kenneth and Diane Wright Distinguished Chair in Population Health and Health Equity at VCU. So, Steve, I hope it's okay if we go on a first-name basis.
Absolutely.
Let's start with some context. Your new study is a companion to a Viewpoint piece that you authored in JAMA in March 2023, and that one was titled The New Crisis of Increasing All-Cause Mortality in U.S. Children and Adolescents. In what years did this issue begin to emerge, and what caused you to notice it?
Well, in that analysis that we published last year, we were reporting a new increase in all-cause mortality between 2019 and 2021. It was the largest increase in that age group that we had seen in half a century. We found that all-cause mortality had increased by 20% at ages 1 to 19 between 2019 and 2021.
Was that a surprise? Was this from the pandemic, or what was going on?
Well, the initial speculation obviously was that this had something to do with the COVID-19 pandemic, but once we dug into the data, we discovered that COVID-19 played a marginal role in explaining this increase, and that most of it was attributed to injuries, in particular homicide, suicide, drug overdoses, and car accidents.
So this was a distressing turn of events, it sounded like, because during the first decade of the 2000s and in subsequent years, there was some progress in terms of mortality rates from injury and from, fatal pediatric diseases. Is that correct?
Absolutely. That's what was so troubling about this, is that we've seen remarkable progress in lowering pediatric mortality rates over the past decades. Some of it due to progress in treating pediatric diseases, but also enormous progress in reducing deaths from injuries. So this turnaround was concerning.
In your Viewpoint, you mentioned what you thought were some of the key drivers of these trends. Can you say more about it?
Well, when we say that all-cause mortality increases, we basically mean that deaths from any cause have gone up, and that essentially means that children are less likely to survive to age 20. In order for that to occur, all of the gains that we are accomplishing in pediatrics, in both the treatment of medical disorders and the prevention of injuries, are being offset by essentially 4 causes of death. As I mentioned, homicide, suicide, car accidents, and drug overdoses. So essentially, 4 man-made causes are actually claiming more lives than all the lives that are being saved through the other advances in treatment and prevention.
Yeah, and your new paper is looking at racial and ethnic disparities in these types of deaths, and all deaths among children and adolescents. What prompted you to look at the information from that angle?
Well, when we looked at the analysis last year, we began to look into racial and ethnic disparities and saw some remarkable differences. So in this study this year, we are taking a more detailed analysis. And one of the most important findings that jump right off the page from the new analysis is that this increase in all-cause mortality that we thought had begun in 2020 in our paper last year actually began much earlier for certain racial and ethnic groups. For example, in Hispanic and American Indian and Alaska Native youth, all-cause mortality began increasing in 2013. In Black youth, it began increasing in 2014. It's because it didn't increase in the white population until years later that we saw last year an aggregate increase in all-cause mortality starting in 2020.
So you had to dive deeper into the data to actually understand that the trends had actually started much earlier in Black and other youth.
Yeah, it's a very good case example of where disaggregating data by race and ethnicity really opens our eyes to new insights.
Can you talk a little bit about which racial and ethnic groups are experiencing the widest disparities in deaths and what is driving those disparities?
The largest disparities that we see are among American Indian and Alaska Native youth and Black youth. Their all-cause mortality rate is double that of white youth. And a lot of that has to do with injuries. There is a disproportionate increase in death rates that are due to firearms and motor vehicle crashes in those populations.
Yeah. So, do you have a sense of the underlying causes of those increases in firearm injuries and motor vehicle crashes?
Well, among Black youth, the majority of the firearm deaths are being caused by homicides, whereas in the American Indian and Alaska Native youth, the majority of the firearm deaths are related to suicides. The statistics are quite alarming. Homicide rates in the Black population began increasing in 2014. They had increased by 76% between 2014 and 2020, so that by the most recent analysis, the homicide rate in Black youth was almost 13 times higher than in the white population. The increase in suicides in the American Indian and Alaska Native population has resulted in a rate of nearly 3 times that of the white population. So we're seeing a dramatic increase in homicides and suicides among these youth, most of which is related to firearms.
In your earlier viewpoint, you mentioned that the underlying causes call for research and policy efforts, and you named some of those as being depression, suicidality, opioid use, systemic racism, societal conflict. Do you have a sense of what policy steps are warranted to address these issues?
Well, the low hanging fruit, although not the easiest challenges to overcome, is to deal with gun control policies. The fact that firearms play such a prominent role in explaining this increase in all cause mortality makes it very important for us to agree on sensible gun control policies to prevent the access to firearms among young people and to decrease their lethality. We think that a lot of the increase in firearm related deaths has to do with increased access and availability of firearms. But it's also very important that we deal with the mental health crisis, which is clearly contributing to the increase in depression and suicide among youth, but also probably plays a role in the increase in youth violence. And that ultimately requires us to deal with the social determinants of health, the social and economic conditions that are going on in our communities and neighborhoods, and the stresses that are being imposed on youth these days that lead to conflict or internalizing their stresses by hurting themselves.
So, as a pediatrician and for our clinicians in the audience, these are important, multifactorial, very complex and challenging conditions. Do you have advice for me and other clinicians on how we can best support?
I think the first step is increased awareness. So, heightened attention to whether children are struggling emotionally, screening for depression is an important step, and helping parents be more alert to the potential emotional stresses that their children are dealing with. In terms of injury prevention in pediatrics, we recommend a whole series of health maintenance interventions to decrease the risk of injuries, from hot water heaters to swimming pools. Firearms also needs to be one of those, to make sure that if there are firearms in the home, that they are locked and that the ammunition is kept in a separate location. But we also have to do more to deal with the problem of access to behavioral health services and mental health services, which is a challenge in our marginalized communities and especially in rural areas where access is so difficult.
So, there's no shortage of next steps to take, it sounds like. What do you see as some of the important next research areas in this field?
Oh, there's a lot to try to unpack here. We do need to understand the root causes of the increase in firearm related deaths that go beyond the access to lethal weapons and try to understand the sociologic conditions that are going on in our communities that make Black and American Indian youth particularly vulnerable to these kinds of injuries. We saw an increase in mortality from motor vehicle crashes. We need to understand a bit more about what's responsible for that. This is probably due to a combination of factors involving alcohol and changes in driving practices during the pandemic, but also less use of occupant restraints and the use of older vehicles that may increase the risk for injury. But we need further research in those areas. And obviously, the mental health crisis is pretty obvious to us that today's youth are struggling with emotional challenges and increases in depression and anxiety. But understanding the root causes of that is still important territory to cover. For example, some theories speculate that cyberbullying or other social media stresses have played a contributory role. But we need to understand more about what's responsible for the terrible mental health crisis that's occurring in youth. Keep in mind that this increase in suicides that we've observed in youth began in 2007 and has been increasing since then.
Well, Steve, I'm always impressed with the scope and the breadth of your research and how many important issues you're able to touch on with your studies. So thank you so much for your ongoing insights in population health and for your research to put social factors and health equity in the spotlight.
Thank you, Tracy.
This is JAMA Senior Editor Dr. Tracy Lieu, and I've been speaking with Dr. Steve Woolf about mortality among U.S. youth. You can find a link to this article in this episode's description. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Daniel Morrow at the JAMA Network. Thanks for listening.